Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about Kaposi Sarcoma. Definition: Kaposi sarcoma is a malignant tumor derived from endothelial cells. It is manifest by multiple vascular tumors that usually occur first in the skin, where they appear as purple macules, plaques, or nodules. It is associated with human herpesvirus type 8. Kaposi sarcoma: in A we can see purple macules and papules, and in B, in dermis, we can see strands and clusters of spindle cells, hemorrhage, and blood-filled vascular slits. Incidence: the disease occurs in three settings. Classic Kaposi sarcoma is a chronic cutaneous disorder that occurs primarily in elderly men, usually those of Eastern European, Mediterranean, and Middle Eastern descent. This is the type described by Maurice Kaposi in 1872. It remains an uncommon disorder with an annual incidence in the United States of approximately 0.05 per 100,000 population. It affects men 10 to 15 times more often than women and occurs most often in people older than 50 years. An aggressive lymphadenopathic form occurs primarily in Equatorial Africa, where it accounts for approximately 9% of all cancers. This type mainly affects young men and is rapidly fatal. As associated Kaposi sarcoma, which was first noted in 1979, represents the most common neoplasm associated with AIDS. Kaposi sarcoma occurs most commonly in LGBTQ males with AIDS, in whom it disseminates and is frequently fatal without HIV treatment. In the United States, the incidence of AIDS-associated Kaposi sarcoma has decreased dramatically because of potent antiretroviral therapy or ART. Types of Kaposi sarcoma: classic, lymphadenopathic, and AIDS-associated. History: the skin lesions in Kaposi sarcoma are usually asymptomatic, so patients seek advice because of the concern over appearance or uncertainty about the nature of newly appearing skin lesions. In some patients, Kaposi sarcoma may be an incidental physical finding. In this setting, it often is the first sign of AIDS, so the physician should obtain a blood test for HIV. Kaposi sarcoma can also develop in patients receiving immunosuppressive therapy for organ transplantation and other diseases. Physical examination: lesions of Kaposi sarcoma may appear as macules, papules, dermal plaques, and nodules. However, in all forms, the lesions are characteristically purple. In the classic type of Kaposi sarcoma, multiple lesions are usually located on the lower legs, where they may be accompanied by edema. In AIDS-associated Kaposi sarcoma, lesions may occur anywhere on the skin and range in number from 1 to innumerable. Lymphadenopathy is also frequently present in patients with AIDS. Kaposi sarcoma may also involve the mucous membranes. When examining the mouth, one should also look for oral hieroleucoplakia as another sign of AIDS. Differential diagnosis: a solitary macule of Kaposi sarcoma may be subtle, resembling a bruise. Papules and nodules may be confused with angiomas, although angiomas usually are rather bacillary. Bacillary angiomatosis is a condition that also occurs in patients with AIDS. It is manifest by red or purple papules that may resemble Kaposi sarcoma. Biopsy of bacillary angiomatosis, however, shows a benign process, and a Warthin serous stain reveals clusters of Bartonella bacteria, the same microorganisms that cause cat scratch disease. Distinguishing bacillary angiomatosis from Kaposi sarcoma is important because bacillary angiomatosis is benign and responds to erythromycin therapy. Differential diagnosis of Kaposi sarcoma. The conclusion of differential diagnosis of Kaposi sarcoma is bruised angioma and bacillary angiomatosis. Laboratory and biopsy. The diagnosis of Kaposi sarcoma is confirmed with a biopsy that shows a proliferation in the dermis of spindle cells arranged in strands and small nodular aggregates. The spindle cells also attempt to form small blood vessels, resulting in slit-like spaces filled with red blood cells. Hemorrhage is common. Lymphocytes and histiocytes may also be present. As mentioned above, patients suspected to have AIDS-associated Kaposi sarcoma should have an HIV serologic test. Therapy. Early classic Kaposi sarcoma may require no therapy or only occasional excision of a papule or nodule. With more advanced cutaneous disease, local radiation therapy is highly effective. Patients with disseminated disease are treated with one or more chemotherapeutic agents. As associated Kaposi sarcoma has been treated with combined antiretroviral therapy and then local radiation therapy, intralesional interferon alpha or intralesional chemotherapy, example vinblastine. Disseminated disease is treated with a combination of zidovudine and systemic interferon alpha or with systemic chemotherapy using agents such as pegylated liposomal doxorubicin, paclitaxel, vincristine, vinblastine, bleomycin, and etoposide, either alone or in combination. The conclusion of therapy for Kaposi sarcoma: initial and local therapy include radiation therapy and excision, and alternative therapy include interferon alpha, intralesional or systemic, and chemotherapy intralesional or systemic. Course and complications. Classic Kaposi sarcoma progresses slowly, and because it affects primarily elderly patients, many die from other causes. In the United States, the average survival time for patients with classic Kaposi sarcoma has been reported to be 8 to 13 years, but much longer times have been noted and spontaneous remission have occurred. Patients have an increased frequency of second malignant disease, especially lymphoma and leukemia. Lymphadenopathic Kaposi sarcoma disseminates rapidly to internal organs and results in early death. As associated Kaposi sarcoma also disseminates early in its course, but some patients respond to therapy and many die from other causes such as opportunistic infections. Pathogenesis. Kaposi sarcoma is a malignant disease in which endothelial cells proliferate to form tumors. Multiple tumors apparently result from a multifocal rather than a metastatic process. Immunosuppression may play a permissive role because in the United States the disease occurs most frequently in patients who are immunosuppressed by drugs or AIDS. The findings of Kaposi sarcoma in several homosexual patients who are HIV negative and the epidemic occurrences of lymphadenopathic Kaposi sarcoma in Africa also suggest an etiologic role for an infectious transmissible organisms. In this regard, human herpesvirus type 8 has now been detected in all forms of Kaposi sarcoma and so is strongly implicated in the pathogenetic process. Clinical case. A 36-year-old man presents with multiple violations of purple non-tender macules and nodules on his lower limbs and hot plate that have gradually increased in a number over the past 2 months. He also reports unexplained weight loss and recurrent oral thrush. On examination, there is known pitting edema of the legs and multiple purple-red plaques and nodules on the skin and oral mucosa. He has generalized lymphadenopathy. Which of the following is the most likely diagnosis? A. Bacillary angiomatosis. B. Kaposi sarcoma. C. Cherry angioma. D. Pyogenic granuloma. And E. Cutaneous T-cell lymphoma or mycosis fungoides. According to our explanations, it's clear that the correct answer here is B, or Kaposi sarcoma. Explanation. Kaposi sarcoma is a vascular malignancy associated with human herpes virus type 8, commonly seen in immunocompromised patients, especially those with HIV or AIDS. Lesions are typically violaceous macules, plaques, or nodules involving skin, oral mucosa, and sometimes internal organs, often associated with lymphadenopathy, edema, and systemic symptoms. Differential diagnosis highlights bacillary angiomatosis are vascular lesions in HIV, but usually bright red and friable and caused by Bartonella. Cherry angioma are small, bright red, benign papules in older adults, and pyogenic granuloma is rapidly growing and bleeding friable vascular papule. And mycosis fungoides are patch or plaque stage with scaling and chronic course, not violaceous nodules. Okay, this was an explanation about Kaposi sarcoma. Thank you for your attention.